My name is Tressa Moeller. Today is October 12th at 2:50 p.m. and I will be doing the enema. So I'm going to first start off with grabbing an enema bag and filling it between 500 to 1,000 milliliters full of warm water. Once doing this, I will get it over the trash can or a sink, unclamp the clamp, and lubricate it or prime the tubing with the warm water until it's at the very tip, making sure not to touch it on the trash can or the sink. I will then hang it back on the IV line, walk into my patient's room or walk over to my patient, make sure I tell them who I am and that I'm going to be doing an enema, check their patient identifier, provide privacy, and do some hand hygiene, and put on my gloves. Making sure they've had an enema before, understanding the process, I will then roll them onto their left side, putting their right leg at the highest possible position, bent at a highest possible position. I'm going to cover them up and make sure there is a absorbent pad underneath of them, just in case they can't hold it. I'm going to place a disposable towel and a bedpan at the foot of their bed, so after I'm done with the enema, they are ready to be used. Okay, so now I'm going to lubricate I'm going to uncover them, but not slightly enough so where you are not totally exposing them. I'm going to lift a butt cheek, and I'm going to then enter and make a twisting motion and point it towards their umbilicus, not entering more than 3 to 6 into their rectum. I'm going to then slowly let it out and hold this bag at hip level. If they're tolerating that well enough, I can hold it 12 to 18 inches above their rectum level. If they're starting to feel discomfort, I can then either lower the bag or slowly clamp this off to make it a slower rate. Once the solution is done or they have a feeling of defecation, I will remove the enema, place it in the disposable cloth, cover them back up while I dispose of the enema in the trash can, and then place them on the bedpan. Trying to make sure they can hold it between 5 to 15 minutes after I have put all the solution in them. If they can't, just hold it as long as they possibly can. I will take off my gloves and have them call me whenever they are finished with their defecation.